phases of the cardiac cycle, due to the changes in the intravascular pressure, there will be intermittent expansion of the arteries and veins, and they will be generated as the waves. And you can, where can you sense the, what is the most common site where the pulse is examined? Where can you sense the pulse?
Radial pulse.
Radial pulse. Where is the radial pulse felt?
On the wrist.
On the wrist. Okay. Okay. So it actually refers to the wave. It is not actually, it is not the blood flow, but rather the wave that is generated due to the expansion of the arteries or the vein, which is a result of the intravascular pressure changes during the various phases of the cardiac cycle. So as a result of which you can sense this pulse on the various sides of the body, isn't it? So what are the various sites of examination? The next person I have today is all I'll ask. Pratisma, so what are the very more common sites where you can examine the pulse?
Ma'am, the most common is radial artery in the wrist. And along with that, there is carotid artery at the neck, femoral artery at the groin or inguinal part, popliteal artery behind the knee, posterior tibial artery near the ankle joint, and dorsal pedis artery on the foot.
Okay, so the most common site, however, is on the radial artery, but usually the other sites that are used for the examination of the pulse usually happens like this. This is the carotid artery, and then this is the popliteal artery. This is the at the groin is the femoral artery, posterior tibial artery, and the dorsal pedis artery, isn't it? So these are the various sites. Usually the pulse is felt usually on the superficial arteries, which are located on the more superficial areas on the skin, are usually the site of the examination of the pulse. Okay, now let us come to the examination of the arterial pulse, or the pulse from the radial artery. The person that I would like to ask would be Karki Saurav. Saurav Karki.
Yes, ma'am.
Okay, can you tell me a little detail about how you feel the pulse in the radial artery? What are the various instructions you give to the patient? What is the positioning of the hand? What are the various fingers that you use, and what are the significance of those fingers? Do you remember?
Sorry, ma'am.
Sorry, man. This you should know. No.
Relax.
Who knows, Ranjana? Yes. Okay. Yes. Just try something. Relaxed position. It can be either sitting. Commonly on the bedside, it is usually done while sitting. But if the patient is, it can also be done in the sitting position, or the patient is slightly upright. But the most common side when you are doing in the clinical setting is on the sitting position, asking the patient to be calm and relaxed. Okay. Now, what will be the position of the subject's forearm?
Middle finger, forefinger, and index finger should be used for palpitation.
Is the position of the forearm of the subject, not your. We're talking about the fingers that you are going to use. We're talking about the position of the patient's forearm. Should be, and the wrist should be slightly flexed, isn't it? Slightly, it should be flexed so that you can easily identify the location of the arterial pulse. Okay. Now, what you are going? Your 3 fingers, isn't it? So which 3 fingers are you going to use?
Middle finger, forefinger, and index finger should be used.
Okay, index finger, middle finger, and ring finger you are going to use, isn't it? So what will be the positioning? Okay, I'll share. So what will be the positioning of each of the fingers? Tell me, what is the function or significance of each of these fingers?
I'm confused, ma'am.
You can look at the picture there. Can you see the slide?
Yes, ma'am.
Yes. So we can see that the distal finger is situated like distally towards the palmar area, and then the middle finger lies, of course, in the middle, and proximal finger is situated like it's proximal to the artery or towards the heart, proximal to the heart. Distal finger is away from the heart. Now, what is the significance of each of these fingers? Do you remember or do you not remember?
Pressing should be done by ring finger.
Huh?
Ring finger pressing should be done slightly more by the ring finger.
Ring finger. Okay, so ring finger is going to slightly compress the artery, isn't it, towards the distal end? So why, by compressing the artery towards the distal end, what are you facilitating or what are you avoiding?
I don't know.
Okay, okay. Then I will ask Abhigya Acharya.
Yes, ma'am.
What are the significance of each of these fingers?
The distal finger is used to block the ulnar flow, backflow of the ulnar artery from ulnar artery, and the middle finger is used for to identify the pulse, to measure the pulse.
Very
And
good. Very
the
good.
proximal finger is used for identifying the arterial wall condition.
Okay, rather than identifying the arterial wall condition, rather it makes the blood flow slightly turbulent so that you can sense it by the middle finger and you can identify or detect the pulse, isn't it? Okay,
Yes.
very good. Very good. So the distal finger or the ring finger, it is used to slightly compress the artery at the distal end. So this compressing of the artery at the distal end will prevent the transmission of this pulse and makes it does not allow it to get vanished through the palmar arch, or it will prevent the transmission through the palmar arch. Similarly, if we are looking at the middle finger is the one that is used for feeling the pulse. Main finger for feeling the pulse is the middle finger, and then there is the proximal. So the proximal finger is what it does is that the pressure that is exerted by the proximal finger will make the blood flow more turbulent, so that this turbulence of the blood flow can be detected as pulse by the middle finger. So these are the significance of the three fingers, and that is how you are going to detect the pulse. Okay. Now coming to, so once you do this and you detect the pulse, then what is the duration of the time that you will look for? For how long will you continue to sense or feel this pulse? For a minute, isn't it? What is the normal pulse rate? Who is going to say? What is the normal pulse rate? K.C. Ranjana. Ranjana K.C. What is the normal pulse rate?
60 to 100 per
60 to 100 per minute, per hour, per second?
Per minute, ma'am.
Per minute, very good. So if the pulse rate increases, then what is the condition called?
Tachycardia.
Tachycardia. And what the condition in which the pulse rate decreases, that is called as the
Bradycardia.
Bradycardia. Okay. Do you know the rate of below this? It is called as tachycardia. Above this is called as tachycardia. Below this is called as bradycardia. So if it is below the normal range, that is, if it is less than 60 per minute, then it is called as the bradycardia. And if it is greater than 100 per minute, it is called as the tachycardia. So can you name some physiological condition in which a person's pulse rate is excessively increased? Ranjana?
During exercise.
Okay, very good. Exercise is one of the most common physiological condition in which an individual shows excessive tachycardia. Anything else?
And
Fear, anxiety, isn't it? Any kind of
yes,
condition that results in excessive sympathetic stimulation will also result in the increased rate of the pulse. That is called as the tachycardia. What about bradycardia?
In athletics, ma'am, there is bradycardia.
Yes, in prolonged, in individuals who have been practicing at least athletic or any kind of sports activities for quite a long time, in those individuals, there is physiological bradycardia is often a most common feature. Any pathological condition that you can think of in tachycardia? Very common pathological condition.
Diseases like
diseases. Okay. Okay. Any kind of abnormalities with the heart can result in tachycardia, but any other features other than the cardio-CVS cause? Most common cause? Any kind of infections that might result, any kind of condition that might result in fever, which is often a symptom of many underlying associated disease. The fever, the most common feature that is accompanied with fever is usually tachycardia, isn't it? Similarly, other important and very common is the thyrotoxicosis. Whenever there is excessive thyroid hormones, then this thyroid hormones will cause the increased activity of the heart, and in turn will also increase the rate of the pulse and is responsible for initiating the tachycardia. Okay, so what are the various, okay, thank you Ranjana. So the next person I'd like to ask would be Janvi Bansal. Janvi Bansal, not present. Last. Suprabha.
Yes, ma'am.
Okay, so Suprabha. So can you tell me what are the various features of the pulse, that what are the various characteristics of the pulse that we are going to see? What are the various features of the pulse that you are going to examine by this method?
Ma'am, rate of pulse,
Rate
rhythm
of
of pulse,
good. Very good.
volume of pulse,
Volume of
then
pulse.
character of pulse,
Good. Character of
condition
pulse.
of the vessel wall.
Condition of the vessel wall. So these are the 5 things that you should be able to say. Whenever you are examining pulse, what are the various features of the pulse that you examine? Number 1 is the rate of pulse. The rate of pulse that we have discussed, the normal rate, what is bradycardia, what is tachycardia, what are the various conditions in which the bradycardia is seen, what are the various conditions in which the tachycardia is seen. The next important is the rhythm of the pulse. So what is the nature, or what is the rhythm, what is the characteristic rhythm of the pulse in a healthy adult individual? Suprabha?
Ma'am, regular beating.
Regular beating. So what do you understand? So if the pulse beats at a very regular interval, that is called as the regular pulse, isn't it? Similarly, there might be some condition in which the pulse will be irregular. And what is that called?
Arrhythmias.
Arrhythmia, because it is out of the rhythm, normal rhythm. It is out of the normal rhythm, so that is called as the arrhythmia, isn't it? Okay,
Yes.
so what are the various features in which the irregular rhythm can be seen? What are some conditions?
Ma'am, like atrial fibrillation.
Yes, one of the most
Atrial
common is the
flutters.
atrial fibrillation. Yes, most common is the atrial fibrillation. Whenever there is fibrillation of the atrium, then there will be inability of the impulses to be conducted at a normal rate, and that will result in the irregular rate of the, or irregular rhythm of the pulse, and that is called as the arrhythmia. Very good, Suprabha. So the next person that I would like to ask is Apeksha Bhattarai.
Yes, ma'am.
Okay, Apeksha, what do you understand by volume of pulse?
It is the total volume during a beat in the artery.
Volume during, what is volume of what?
Ma'am?
When we say volume of the pulse, what volume of what you are saying? It is a total volume. Volume of what? It's not. What do you understand by volume of the pulse?
Sorry, ma'am, I don't know about it.
Okay. Okay, actually the volume of the pulse actually refers to the what is the amplitude or what is the amplitude by which the vessel wall has been moved, or it is rather the amplitude of the movement of the vessel wall. So when the pulse wave is passing, during the passage of the pulse wave, the amplitude by which the vessel wall moves, that is called as the volume of the pulse, isn't it? So do you know how to compare this amplitude of the movement of the vessel wall? How do you detect the volume of the pulse? It is usually done by comparison of the pulses on two sides. So what you have to do is you have to check the pulse on one side, and then you have to compare it with the pulse on the left side. So if you're comparing the right with the left, so both sides of the pulse has to be taken into consideration in order to identify the volume of the pulse. However, it is not very practical. It is not very it is not very identifiable by an individual who has not been exposed to more amount of the of this clinical examination, because it requires very precision to detect the volume of the pulse. So volume of the pulse, it can be due to the high volume can be seen during vasodilation. The vasodilation, which is usually seen as a result of during either exercise or any physiological conditions such as pregnancy. So in those cases, the high volume of the pulse may be detected. Similarly, the low volume, it is usually seen whenever the blood volume is very low. So the low volume is especially seen in case of the hypovolemia, that might which is a common feature of the shock, or it can be seen in heart failure, where the heart is unable to pump out sufficient amount of blood. So any conditions that result in low volume of the blood will also result in the low volume of the pulse. So that is about the volume of the pulse. So the next is the character of the pulse. So what do you understand by character of the pulse? Let me say it. Bidisha Das.
Yes, ma'am.
Bidisha, what do you understand by character of the pulse?
Ma'am, it means the impression of the pulse waveform which is gained by the palpation.
Okay, so when you say this statement, do you understand what this statement means?
Yes.
So if you compare, like if you are habituated to listening to normal pulse, then it is like if you are examining a healthy individual, and if you compare it with an individual who might have some conditions, say such as the say the most common is the say aortic stenosis, then if you compare the pulse wave in these two individuals, it is often seen on comparison that the waveform, in case of the individual who has the aortic stenosis, the pulse, the wave is very slowly rising. So it is usually based on lots of lots of experience. So it cannot be detected by just one or two examinations. So it requires a continuous examination of the normal pulse wave as seen in normal healthy individuals, and then you have to compare it with the individuals who might be suffering from certain conditions that might alter the character of the pulse. So basically it just means the waveform, what is the impression of the pulse wave, how, in what pattern is this waveform being generated. This is called as the character of the pulse. Okay. So this is about the character of the pulse. The next important information that can be obtained by studying of the peripheral arterial pulse is the condition of the vessel wall. So when we say condition of the vessel wall, how are we going to do the examination to detect the condition of the vessel wall? Saksham Gimire. Saksham Gimire. Kumari Ankita.
Yes, ma'am.
Yes, ma'am. So what is condition of vessel wall? How will you detect the condition of vessel wall? What is the normal condition of the vessel wall? How will the vessel wall be in case of the abnormal condition? Do you know? Do you know how it is done to detect the condition of the vessel wall?
Ma'am, I don't know.
You said you said yes with so much enthusiasm that I was thinking that you know lots of things about how condition of vessel wall is detected. Okay. Mariku Sujita. Mariku Sujita. Mathela Jyoti.
Yes, ma'am.
So, how do you detect the condition of the vessel wall? Will it be what? How do you detect it? First, tell me. Do you know? Do you remember?
Oh, ma'am.
Anyone remembers what we studied last time about the rolling method? All right, so actually the condition of the vessel wall means that whether the if any kind of changes has happened in the vessel wall. So the most common change in the vessel wall, if we commonly like palpate the in case of the radial artery here, what we actually do is that we are going to palpate the area beneath the radial artery. So whenever we palpate beneath that area where the Okay, I think I had some glitch. Can you hear me now?
Yes, ma'am.
All right. So what is done is that usually the radial artery is rolled, isn't it? Just underneath by pressing it firmly or by palpating it firmly against the underlying bone, we exert sufficient pressure over the brachial artery, and while we are doing this, often in young individual, we cannot feel anything, like we cannot feel the arteries while we are palpating the radial artery. But it is often seen that in case of the individual who have arteriosclerotic change, which is a very common feature, the arteriosclerotic means hardening of the arterial wall because of the sclerosis, which is often a complication of the old age, common physiological complication of the old age. It is seen that while we are doing this rolling movement, applying sufficient pressure, it is often in case of the young individuals, the arteries cannot be felt. But in case of the old adults, the arteries can be felt, and that is because of the arteriosclerotic changes. And that is how you can determine the condition of the vessel wall. So often in young healthy individuals, while you are palpating, while you are rolling beneath while you are doing this rolling movement, by exerting sufficient pressure, the arteries cannot be felt in case of the young healthy individual. But in case of the old individual, the arteries can be felt, and this feeling of the arteries is due to the changes in the arterial wall, some kind of sclerotic changes that might have hardened the arterial wall. So as a result of which, while you are applying the pressure, then it is palpable underneath. So that is how the condition of the vessel wall is detected. These all are not diagnostic, but they can aid in giving you the general status or general information regarding the health of the artery also. So these are the various features that you will look for while you are carrying out the examination of the peripheral pulse. So number 1 is the rate of the pulse. Number 2 is rhythm of the pulse. Number 3 is volume of the pulse. Number 4 is the character of the pulse. And number 5 is the condition of the vessel wall. Out of this, the volume of the pulse and the character of the pulse is quite it requires a more amount of experience, and they can be very well established in larger arteries and difficult to establish in smaller arteries like the radial arteries. So this is about the study of the peripheral pulse. So while you are carrying out the peripheral examination of the radial pulse, which is the most common site of the examination of the arterial pulse, it is essential that you request the patient to be very fully relaxed, and then you explain to him very nicely what you're going to do, and then you take consent, and only after familiarizing himself and familiarizing yourself with him should the examination process be proceeded. So you ask the patient to sit down, calm down, tell him what you are going to do, and then you are going to count the pulse. So initially you are going to count the pulse for 2 minutes, and then after that you're going to count for 1 minute, and then 0.25 minute, and then 0.25 minute, and then you're going to compare for the accuracy. And the other features that you should look for is rate, like I told you, rate rhythm, as well as the condition of the arterial wall. So this is how the radial pulse is to be examined. Okay, so the other site of examination of the radial pulse that we have discussed, what are the other site other than the radial artery? Similarly, the arterial pulse can also be recorded with a device which is called as the physiograph. Okay, this physiograph is actually an instrument that is present in the physiology lab. So by that also you can determine the arterial pulse, but that is not commonly done. The most common easy bedside experiment that can be done is by using your fingers only, the 3 fingers only. Okay, because the physiograph often either it does not give very accurate readings, or sometimes there are lots of deficits when you are doing the examination by the help of a physiograph. Okay. So what else is there? Okay, I think that's it. There are several questions in your manual that it's no point discussing right now, because it requires that you be present, and then we do it in the lab. So that's it about the pulse. So that's all for today. I think that's all. If you have anything, you can ask. You can. Do you have manuals with you?
No,
if you have
ma'am.
manuals, just go through the manuals. Otherwise, I think that's all for the day. Okay. Just let me download your attendance, and I will leave you early today. Not much. Okay, then that's all for today. Okay, please go through the study materials. Anything you want in particular? Any lectures that you have not yet obtained or anything? You will have everything, isn't it? Okay, that means you have everything. All right, then. That's all for the day. So have a good day, everybody. Bye-bye.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.